So, the bundle of nerves just beneath the nose is a key self-defense target. In a real fight, experts recommend a simple defense. A sharp strike to the philtrum, then escape. But is a quick hit enough to take out an attacker? This $250,000 punching bag will provide the answer.
The head form I brought today is called the Focus head form. It's probably the most advanced head form that there is out there right now.
FOCUS stands for Facial and Ocular Countermeasure Safety. Developed in conjunction with the U.S. Army, the FOCUS head was designed to study facial injuries and is fitted with special sensors called load cells that measure the force of an impact.
The objective of this test is really to see how much force is generated when Amir does his strike, because we know the tolerance of the human body. Okay, you ready, Amir?
Mm-hmm.
Okay. 3, 2, 1, strike.
Amir hits the dummy with 506 pounds of force, a level that will cause severe pain with the potential to break bones. Even with the force of an average human being, this is a devastating strike. The sensors in the FOCUS head form reveal why. A 500-pound strike to the nose will usually crush the nasal cartilage and break the nose. Nerve bundles in the nasal area send pain signals to the brain. The eyes tear up, obstructing vision. Blood, swelling, increased mucus production, and fragments of bone make breathing difficult. Small blood vessels in the nostrils break, causing profuse bleeding. Many people believe that striking the nose with the heel of the palm will kill an attacker by driving the septum straight up the sinus cavity and into the brain. But this is a myth. 2 bones deep in the skull block direct passage from the sinuses to the brain. Even so, it's still an effective blow for self-defense. A sharp blow beneath the nose can incapacitate an attacker. But the face isn't the only vulnerable point. The lower body also has a number of weak spots that are susceptible to a quick defensive strike.
Me personally, I'd like to attack the knee. It's vulnerable because the knee has no lateral movement. It doesn't move from side to side. So if you can attack it on a particular angle, that's going to incapacitate an opponent very quickly.
So, Bren, we're going to ask you to kick this crash test dummy in the knee, and we're going to actually measure how much force you generate with that kick. We're actually going to use a TechScan pressure pad. That will tell us exactly how much force or pressure is generated during that kick. Ready, Bren?
Yep.
Okay. 3, 2, 1, kick. Okay.
As a 5th-degree black belt in Taekwondo, Bren can do a significant amount of damage with any kick.
And you generated 251 pounds per square inch.
That's probably enough to shatter the patella. Definitely would snap the ligaments, press the leg back so fast, it'd do a lot of damage.
And you obviously injured my sensor as well. I think this one is definitely done for.
Clearly, an expert strike to the knee is devastating. But can an average person take out an attacker's knee, or at least cause enough damage to get away? The answer lies in the science of the strike. Experts say that it's not the force of the impact that matters most, it's the direction. The key lies in the way the knee is designed to bend in flexion to facilitate sitting. But when the leg extends to a standing position, the joint locks and cannot bend in the other direction. Striking it in this position can cause hyperextension and severe damage to the delicate internal ligaments and cartilage pads within the knee joint. Snapping the joint backwards can damage the anterior cruciate ligament, or ACL, and striking it sideways can take out the medial collateral ligament, or MCL. Either way, it's like chopping down a tree. Without structural support, the knee collapses, and so does the attacker. So even an average person can incapacitate an attacker by striking their knee joint.